we should have 20 people, 18 signed up, so there might be some more stragglers, but they're just, hopefully this records. If not, I'll have to re-record it. That's just the way it goes sometimes. I just busted my new video capture card, and so the old one is very finicky, so we'll see. So it pays to show up, right? Instead of watching online. I always say too, like, I usually like to, for those that are watching at home too, I'm sorry, but I'm going to say this anyways, but once we get to the Q&A, I usually like to shut off the live stream so we can talk a little more freely. So since you've paid to be here tonight, you get the added benefit of, just asking any question you want, and then we'll shut off that camera. Well, it'll probably shut off on its own the way that it's working tonight. But all right, I don't really have an introduction slide. So my name is Dan. I see some new faces, so thank you for coming. I've been a pharmacist here now since 2010. Started back in 2003, so I guess this is my 20th year as a licensed pharmacist. So I got a few years under my belt. Really got involved with compounding pharmacy because my father-in-law was compounding at Ye Olde Pharmacy, if anyone knows that pharmacy. That goes back to 77 in Glendale, and my father-in-law started compounding, I would say the late 80s, early 90s. He got a suppository mold and a hot plate, and they started making progesterone suppositories. So that's kind of where I started. My own personal story was I had really bad acid reflux in pharmacy school and was put on all the traditional medications. And fortunate or unfortunate, depends on how you look at it, fortunate for me that they didn't work, because that led me to here, I believe. So functional medicine, repairing the body, getting to the root cause of the problem. For me, it wasn't that I was producing too much stomach acid, it was that I wasn't producing enough. And I'm not going to get into that story tonight, but there's actually a test called the Heidelberg test where you can swallow a capsule to actually prove to yourself and your doctor if you are overproducing acid or not enough. But that's a story for a different day. So on with the show. So welcome. I do get ahead of my slides, so I apologize ahead of time. So we might jump around a little bit, but we'll try to keep it moving in the right direction. But my goal for everyone tonight is that, and every day that I'm here, quite frankly, is to achieve optimal wellness, optimal health. And what does that mean? It's going to be different for, I think, each individual, but I'm hoping to live to be 120. I just got done reading Dr. Mark Hyman's book, Forever Young. It's a fascinating book, again, on really root cause of illness, of disease, and then trying to figure out how can we prevent those issues in the first place. He really opened up my eyes to aging as a disease. So just getting older is a disease of itself. So what causes those telomeres to fall apart? What causes our cells to degenerate? Methylene Blue is going to look a little bit into that and work as an anti-aging product. So that's kind of where we're heading, is how do we live forever? I'm not going to read my medical disclaimer, but it's there. Everything that's presented tonight is just my opinion, so don't take it home and say, Dr. Dan said to stop all my medication and all I needed was Methylene Blue. It's not what I'm saying. So this is for educational purposes only, of course. And as it says, anything that I'm talking about tonight, products and otherwise, the information is not to diagnose you, to treat you. I'm not treating anybody tonight. I'm not even a physician in the state of Wisconsin, pharmacist. We can't treat, we can't diagnose, we fill prescriptions. But so that's what all that says. And then I just talked about this already, so I'm going to skip over that. I will say we're the first accredited compounding pharmacy in the state of Wisconsin, so we're very proud of that as well. So here's our outline. So this introductory, just getting to know Methylene Blue. What is this drug even all about? What's all the hype about? Get into the history of it is important, I think, to know. And then I'm going to spend a little bit of time on the pharmacology. Why is this drug, how can it be used in a number of different applications at these completely different diseases? You got somebody that might have psoriasis on one end and then malaria on the other and everything in between. Like, how is that even possible? So we'll get into some of the pharmacology. and the diverse mechanisms of action. We could spend all day going through clinical evidence and emerging evidence on methylene blue. I can probably get really long-winded, but I'm going to try to cap this out at about an hour and then leave about a half an hour for questions at the end. So, and then we'll get into this actually pretty soon here in about 5 or 10 minutes, but the safety of this drug and what are some of the precautions that we have to be aware of. This is sold, I mean, you can go on Amazon right now and buy it and probably have it delivered to your house tomorrow morning. But hopefully I will convince you tonight that that's not the best thing to do. So we'll get into that, and there are some contraindications we have to be aware of, and then we'll hopefully have some action plan by the end of the night here. So I've been including this slide in a lot of my presentations. I've just been leaving it in, but we all know this, but I just think it's important to just have it on the top of our mind that we are in a public health crisis. I mean, lifespan has increased, but it is coming at just an exorbitant cost that's not really sustainable in my book and in many others. And I talk about just the increase of pharmaceuticals is just outrageous, and I think we all know that. I see a lot of nodding heads. It's just awful. So we got to come up with another solution, in my opinion. And then that's where the beauty of compounding is we are repurposing a lot of medications that have a lot, in my opinion, a lot of value. The other thing that we compound a lot here is low-dose naltrexone, or LDN, and that's a super popular drug that was, I'm trying to think, it was discovered back in the 1980s, the 1970s, and used for opioid addiction, heroin addiction, alcoholism, things to that nature. But that was at 50 milligrams, where we're compounding that same drug at 1, 2, 3 milligrams, just a fraction of the dose. And doctors are using it for Lyme disease, they're using it for autoimmune disease, inflammation, and things like that. So I don't think it's completely necessary that we've got to come up with fancy new patented pharmaceuticals. There's nothing wrong with that per se, but I think there are some drawbacks, especially the cost of pharmaceuticals these days, I think is just a little bit outrageous. So, and then New Year's resolution, as I kind of talked about, I want to live to be 120, but I don't want to do that like in a wheelchair for the last 40 years either. So, adding years to my life, but adding life to my years, I think methylene blue can really help with that. Hopefully I can prove that tonight with the mechanism of action. We're going to get into quite a bit of the pharmacology, and hopefully we can get those cells in our body to kind of just rework them in a way that they continue to run efficiently. So, methylene blue. So this was discovered, what do I have here in my slide? 1876. So it was actually used in the textile industry as a dye. But then Paul Ehrlich was actually using this then for all types of different things, helping to treat with malaria before newer malaria agents came out. And so that's something to just kind of, again, keep in the back of my mind, that methylene blue can work as an anti-parasitic drug, an antiviral drug, so it has those properties too. We're not going to get a lot into that tonight, but it is important to be aware of that. Methylene blue there is one FDA-approved product for methylene blue out there for the treatment of methemoglobinemia. It's a hard one to say, but methHB, where basically the iron in the hemoglobin protein goes from a positive 2 charge to a positive 3 charge, but basically the hemoglobin loses its ability to carry oxygen efficiently. So not a good thing. We need oxygen to survive. I think we all know that. And so there's applications for that particular IV FDA-approved methylene blue. Again, that's outside the scope of what we're going to talk about tonight, but just know that is out there. So understanding methylene blue's latitude of mechanisms of action. So there's a broad range here. So understanding, to kind of figure that out and to wrap our minds around that, we want to understand cellular respiration, right? So every cell in our body essentially has mitochondria. So I think, and actually methylene blue is used for staining slides and things like that, and to look at different colorization of tissues and such. But the mitochondria, I like to use a lot of car analogies, but think of that as the engine of the car. It produces the energy, is is this little organelle right here. I think I got another picture of it on the next slide. These little, I don't know what, I'm kind of colorblind, purple or violet, I don't know, sure, whatever. That little kidney bean shape organelle. And depending on the tissue, if it's like a muscle tissue, we've got, and I don't know the numbers off the top of my head, but we have a lot more mitochondria in muscle tissue than we do in fat tissue. So depending on the tissue type is going to kind of determine how many of these engines are in that one particular cell, if that makes sense. There's actually a lot of mitochondria, we're going to talk about this in a minute, in our nervous system, in our brain. There's quite a bit of, I always think of like synapses and that electrical current going through our brain, through the CNS. But what I tend to even forget myself is that there's a lot of energy. 20% of our calories, it depends on who you talk to, I'd say roughly 20% of our daily calorie intake is spent on just feeding our brain and keeping all of the synapses running. So that consumes a ton of oxygen. A lot of energy goes to just keeping our CPU, our main computer running in our body. So there's a lot of mitochondria in the central nervous system. It's up here at our 6, 7, 8 pounds of gray matter that we got floating on up here. There's a lot of mitochondria. And when you actually when you get an IV of methylene blue, or if you were, a lot of that methylene blue will actually just gravitate. It crosses the blood-brain barrier very quickly, and it'll flood the central nervous system. And it's helping to feed that, I don't want to say feed, but I guess that's the way I can kind of think of it, is fueling those mitochondria. That could be essentially suffocating. So effects on mitochondria. So and again, this gets a little nerdy, I'm sorry, but methylene blue can donate electrons to the electron transport chain within mitochondria. So if we think of like I'm going to say a V8 engine, you got different cylinders and they're all producing energy and you're getting energy from each one of those. I kind of think of mitochondria in this whole matrix here on the inside of this organelle in every cell of our body. You've kind of got a V8 engine, think of it that way. And some of those pistons or some of those cylinders may start to fail, the way I think of it. So methylene blue can come in and rescue this mitochondria that's beginning to fail and revive it again. So instead of kicking out, I've got a really old Yukon at home, and it goes from an 8-cylinder down to a 4 on the highway. Does anyone else have a car like that? Yeah, okay, I see some nodding heads. So think of methylene blue of coming in and just constantly keeping that engine in your cells always on 8 cylinders. It's running just at peak efficiency all the time. So I can think of it that way. Or if you've got an electric car, it's just constantly giving it charge. So that lithium-ion battery that's in your, I don't know, Toyota Prius or what does Elon Musk make? Tesla. Yeah. Elon, if you're listening to this at home, maybe consider methylene blue as a fuel source, maybe. I don't know how that would exactly work, but something for him to figure out, right? So methylene blue electron donation is used to create ATP. Just think of ATP as fuel, as energy. So the more ATP we have, the better that cell is going to live and thrive. So, and this is where it gets a little bit nerdy. There's different complexes or different cylinders, we'll call them, that produce energy or to help move electrons around, help with energy transport. But methylene blue increases complex 4 activity in mitochondria. So if you're wondering, well, what about complex 1, 2, and 3? Those are more work on food sources. And so if those earlier complexes begin to fail, methylene blue can revive that cell by just helping it with this 4th complex. So again, going back to that car analogy, if you've got some cylinders that are misfiring in your engine, that engine can still run, that cell can still function because methylene blue is kind of coming to the rescue and still keeping a couple of those cylinders up and going. So, is that live stream working, Dane?
This says viewers might get a little buffering.
Oh, one more reason to attend a live presentation, right? Yeah, no more, yeah. And this is, speaking of Dane, he did a wonderful video on methylene blue a few months ago that he explains very eloquently those complexes and how to keep that engine of the cell, the mitochondria, running very smoothly. So Kudos to Dane for that. Thank you.
Thanks.
Who recommended you to study methylene blue?
Yeah,
That was okay. That's what I thought. Yeah.
I was skeptical.
Yeah, you were.
For now, 100%.
So here's some of the mechanisms of action of methylene blue. So inhibiting monoamine oxidase A. So we'll talk a little bit about that, but this is one of those precautions if somebody, I'm not going to get into all the meds that are monoamine, that need monoamine oxidase to get metabolized, but if you're on a drug that's metabolized by this, usually you know it. And so if you're on a drug like that, I think selegiline might be one of them, but then you would not want to be on methylene blue because they don't mix well, put it that way. So on a good note though, it inhibits tau protein. We'll talk about this in an upcoming slide here, but tau protein is implicated with Alzheimer's, and so it inhibits tau protein aggregation. So that's a good thing. Talked about its antiviral and antibacterial properties already. It's got a unique auto-oxidizing property where it can go from methylene blue, what does that even mean, to leucomethylene blue. So it can give this electron away and then it can receive it again and literally kind of go back and forth, back and forth, back and forth. So like if you compare that to, let's say like vitamin C as an antioxidant, right? Vitamin C goes in, it gets reduced, and now it's basically useless. It's not working as an antioxidant because it's been oxidized itself. So what do you got to do? You got to take more vitamin C every day and so on and so forth. Think of methylene blue as just a constant renewal source, which is, again, rather unique that way, is that it can kind of clean itself up, get rid of that electron, give it back, so on and so forth, and keep that ATP, keep those cylinders of the cell working. And then in this pleiotropic effects on various tissue oxidases. So what do I mean by that? I'm not going to get a lot into that tonight, but it can work on so many different enzymes as well to basically maximize its function, is the best way I could describe it. So take home point number one, methylene blue has a high affinity for the nervous tissue. So again, reason for that is there's a lot of mitochondria in the nervous system, and so that's where methylene blue likes to gravitate towards. So, yeah. And this is kind of how I think of the nervous system too, is like we've got this nucleus, we've got the main part of the cell, we've got all these axons and electrical fibers spreading out all over in our brain, but there's energy sources in here. There's engines all over the nervous system, and they need power to work. They need power to run. They need power to move those electrical currents back and forth, create memories, all of those things. So the better we can keep this little guy going and alive, the better our brain's going to work, the better our nervous system's going to work. So here's that unique pharmacokinetic effect. So this is where it gets a little bit tricky. I kind of think of this going back to the naltrexone because we dispense so much of that here, but like at a high dose, methylene blue is toxic. And high dose, when you look at the literature, anything over, this is a little bit gray, but I would say anything over 5 milligrams per kilo is what you'd want to consider a high dose. Some research I was looking at is 6 milligrams, 8, 9, 10 milligrams, but I think for tonight's discussion, I would cut it off at 4 milligrams per kilo, maybe even 2. I'm more conservative on this. So what ends up happening here then is as the dose increases, you will see, and again, obviously this is patient specific, but you'll see an increase in benefit. But then you're going to get to a tipping point, and I don't know what this dose is for you. I don't know what it is for me, quite frankly. I mean, this is where you got to work with your doctor and to figure some of this stuff out. But let's just say you're starting out at 0, and this is a 0.5 milligram, 1 milligram, 2 milligram. That might be your own chart for methylene blue dosing, but you get the next patient, and their peak efficiency with methylene blue, it might be 3 milligrams is their peak dose. So the dosing does vary so much on this. So it's not a one-size-fits-all, and that's again where compounding comes in too. The beauty is, from the pharmaceutical world, you're stuck with certain doses, right? Like atenolol, 25, 50, 100 milligrams, or atorvastatin, I can't remember what they are anymore, 10, 20, 40, 80 milligrams of Lipitor. The pharmaceutical world has siloed, right, all patients, like you can have this dose or, that's it. Or good luck cutting the tablet in half. So the nice thing with Methylene Blue is we can make any strength capsule that's needed, or it's very water soluble. We just make a solution of it. And again, this is where I don't advise this, but you can go online and see all the patients that are like, how many drops do I need to take? And well, how many milligrams per mil are there? I mean, it's like, so you got to be careful on some of that stuff. So. Adverse effects on Methylene Blue. So this is where, again, you look at the literature, it's pretty rare to have adverse effects over 2 milligrams per kilo. I was looking at some research, though, that even, I really wouldn't use this in pediatrics or even infants, honestly, quite frankly. I mean, I wouldn't be comfortable with it. A physician that might deal with it way more than I do. But from, again, this standpoint, I would, from the adult dosing perspective, I think around that 2 milligram per kilo is reasonable. But you can still see some issues here: stomach pain, chest pain, dizziness, headache. So it's not a perfectly clean drug, like it sometimes is viewed out there, that it's super, super safe and everyone can take it. And I would disagree with that. Shortness of breath, fast heart rate, tremor even though it can actually be used for tremor in Parkinson's. We'll talk about that in a minute. Urine discoloration, which actually I was reading an article for psychosis and patients that were being treated with Methylene Blue, and that was the way that the clinician can see that they were compliant with taking Methylene Blue, because they would see what color their urine was. So kind of an interesting fact on that one. To see if your patients are really taking the therapy you've recommended. And reduce the red blood cells, kind of going back to that hemoglobin, where it can muck up the hemoglobin's ability to actually carry oxygen. It can be problematic, but again, that's usually at really high doses. Adverse effects from chemical impurity. So this is where, if you go online, and you can go on Amazon, right now, and have it delivered tomorrow morning to your house, how do you know if you're getting a clean pharmaceutical grade product? So we only work with FDA approved wholesalers in the United States. So that's one thing, that's where we get all our chemicals from.